Kim gives us the okay, we'll. Okay, good. Hello, welcome everybody. Thanks for being here. We'd like to welcome everybody to the Your Health Lecture Series. This is a unique collaboration between Alma College, Saginaw Valley State University, MyMichigan Health, and MSU's College of Human Medicine. The goal of partnership is to bring together local physicians and researchers to speak on topics of general interest to the public. Earlier today, our speaker met with Alma College students to talk about her work. And also we had a group of third-year medical students from MyMichigan, from MSU, who were able to speak to our pre-medical students as well. So very exciting. Thank you all for being here. I'm going to introduce now Mark Breavy, who's the Director of Community and Government Relations, and he'll talk about our speaker today.
Thank you, Dr. Turk. And as Dr. Turk mentioned, my name is Mark Breavy. I'm Director of Community and Government Relations at Michigan State University College of Human Medicine. And the college and Alma College have been collaborating on the Your Health Lecture Series for at least the past 11 or 12 years. We were trying to figure out exactly how many years earlier, and I think we kind of figured out it was right in that range. And we do this Your Health Lecture Series due to the collaboration and the agreement between the two schools due to our early assurance program. I want to thank Dr. Turk and Alma College for the continuing partnership, and also MyMichigan for co-sponsoring this event as well. I would like to note at the conclusion of Dr. Klugiene's presentation, she will answer questions from the audience and written into the Q&A feature for those that are joining virtually. With that, I'd like to introduce our speaker this evening. Dr. Egle Klugiene is an MD, clinical assistant professor in the Department of Family Medicine at Michigan State University College of Human Medicine. She earned her Doctor of Medicine degree from Kaunas University of Medicine in Kaunas, Lithuania, and is a graduate of the Family Medicine residency program at MyMichigan Medical Center in Midland. She joined the faculty of the MSU MyMichigan Medical Center graduate residency program in 2017, and she has a special interest in women's health and procedural training. She is board certified in lifestyle medicine through the American Board of Lifestyle Medicine. When not at MSU graduate residency program, she works as a family physician at MyMichigan Medical Center in Midland, and her greatest joy at work is teaching residents. Dr. Klugiene.
Thank you, everybody, for being here, and thank you for your interest with lifestyle medicine. I'm not paid to be here, but I'm so excited to have you here in this room and to share with you my passion about lifestyle medicine. And I hope that by the end of the talk today, I will be able to introduce you to 6 most important components of the lifestyle medicine, and share a little bit how I implement lifestyle medicine aspects to my daily clinic life and to the residency program. So, definition of lifestyle medicine I took from the website of College of Lifestyle Medicine, and also wanted to share that majority of information you're gonna see today is from the College of Lifestyle Medicine website called lifestylemedicine.org. So lifestyle medicine is a medical specialty that uses therapeutic lifestyle medicine interventions primarily prevent, but also control and sometimes reverse chronic conditions. And these chronic conditions could be diabetes, hypertension, obesity, coronary artery disease, and many others. So what are those lifestyle interventions which really could prevent and could change the outcomes of the disease? And it might look simple, very simple, but what we eat, how much we are active, how much we sleep, how we look at the world with the positivity, how we connect with others, and importantly, how we avoid the risky behaviors. All of those 6 most important lifestyle interventions could really change our outcomes. Why lifestyle medicine is becoming more popular field? Because traditional medicine, as you may know, and all of us learn in the pre-med, in medical schools, about medications, mechanism of action, different interventions. But the traditional medicine is usually the response already of existing disease. Lifestyle medicine, though, focuses on the prevention of those existing diseases. Lifestyle medicine physicians, as I already shared with some of you, are trained and board certified to provide information about those lifestyle interventions. And what I personally like about being lifestyle medicine physician, because especially in this world of information, social media, people read, and us, we hear so many different things, what seems to be right thing to do, what's not right thing to do, different diets, what you follow. But the College of Lifestyle Medicine approaches to the lifestyle medicine through study, through the study-based information. So it is not what my friend or my neighbor said, it is really study-based medicine. Now, why it is important? And this slide just shows, it is pretty old slide, almost 11 years old, but it really shows that unfortunately here in the United States, our population is very sick. As compared to other developed countries in the world, in the United States, majority of people have 3 or more chronic conditions as compared to other parts of developed countries in the world. And what does it mean? It means we have sick population. It means us physicians, we really have to treat so many different diseases for one patient. Our visits sometimes are very time restricted, but we really need to address so many different problems. So that is one of the reasons why we really need to look and maybe think about how we approach medicine especially from the prevention, but also control disease through the lifestyle modification. Now, this slide shows that despite us being one of the sickest population in developed world, we spend the most money for the healthcare. So there is somewhere the discrepancy that we spend so much money for the healthcare. Unfortunately, we are the sickest. But when we look at the studies, we know that if we compare ourselves to and we get studies from the world, we know that lifestyle interventions really work. So this is just a few words about how lifestyle medicine became a specialty. And as you see, in 2004, the College of Lifestyle Medicine was established. And the college was established because the studies came out showing, there was one study which compared people who had pre-diabetes or impaired fasting glucose. And one group of people was placed on metformin, which is diabetic medication. And another group was asked to implement lifestyle modification, those 6 things I just shared with you about. And what they found, what the research showed, it showed that the group of the lifestyle intervention did much better than the group on the medication. More and more studies came out, and that's when the college was established kind of to summarize all the studies and provide information to others. 11 years later, American Medical Association said, okay, we really need to do something to train physicians and get them board certified. So American Board of Lifestyle Medicine was established, and the first exam was launched in 2017. So as you see, this field is pretty young field, but I am very excited that it seems like it's gaining popularity. Myself, I became board certified in 2020. I used COVID's time to study and get certified. So coming back and talking about how sick population in the United States is, and you can see that 80% of people ages above 65, and they have more than one chronic condition. And what these conditions are, this is hypertension, hyperlipidemia, high cholesterol, osteoarthritis, coronary artery disease, diabetes, chronic kidney disease. Basically, almost all of them are, all of those diseases are preventative diseases. But when we look at our population and what we eat, you can see we really have a big room to improve. Approximately 80% of United States population does not meet fruit recommendation. About 90% does not meet vegetable intake recommendations. We're actually very good getting grains in our diet, but very sadly, grains are coming from processed food, from burgers, tacos, pizza, mac and cheese, and all of other things, very high calorie foods and high fat food. And 75% of Americans meet or exceed the recommendation for protein intake. But again, just more than half do not meet recommendation for natural proteins, nuts, seeds, and soy products intake. So summarizing, what we see, what America eats is unfortunately so much processed food, very rich in fat, very rich in calories, and very low in fiber. And all of those things we will talk in the second leads to the chronic inflammation and chronic disease formation. I put a slide just briefly share with you the basic, right? So what is the processed food? Processed food is something, is exchange food. Is something good is taking, and that's usually either fiber or nutrients or water, and something bad is added, and that's usually sugar, fat, additives, and etc. So this is the slide showing the anatomy of the grain. And the grain, the bran, that outer layer is the best. It has so much nutrients and it has so much fiber in there. But when we buy a, let's say, white flour or just a regular pasta, we buy things when the bran is removed. So in order to make the white flour, the manufacturer just remove the bran and makes that white. And then white flour, if you add butter and sugar, you cook, you make a donuts, you make a cookies, that's the product we eat. That's the processed food. Also, I feel that in this country, we could do a little bit better job with the beverages too, also soda intake. And I just sharing with you that in one 12-ounce can of regular soda, there are 10 teaspoons of sugar. So no wonder why we have a population, sick population, who has diabetes, hypertension, hyperlipidemia, chronic inflammation. And not only that, people come to us, physicians, they say, I feel tired, I don't have energy, I feel sleepy all the time. We run some tests and we say, I cannot find the pathology, I see chronic inflammation in your body. And the answer is, it is what you eat. That's causing your chronic inflammation and does not help you to feel good. The nice part is that 80% of the population wants to be healthier, but does not know how. About 5% of the population was on some type of the diet at some point in their life. I personally don't like the word diet. I like the word lifestyle because I strongly believe that diet does not last for a long time. People just follow the diet for short periods of time, and then they go back to the old eating and habits. But the lifestyle is the key. And I totally agree with 80% of the population wanted to get better, but just simply not knowing how. Just being involved in the lifestyle medicine visits, talking with my patients, I want to echo that people really want to get better, but they don't know where. So what College of Lifestyle Medicine says, what food do we need to eat? And they suggest predominantly plant-based food. And sometimes my patients say, so I think I need to be vegan or vegetarian. And I say, no, I really don't say that. I say that your diet predominantly should be a plant-based diet. And when I say what is the um, healthful plant-based diet, is the same thing what we just talked about. The diet rich in fiber, when good things are not taken away and bad things are not added. And when I talk with my patients, I always say, during especially initial visits, I always say, you can eat as much as you want. You should not limit how many vegetables, fruits, grains, and legumes, beans, lentils, seeds, and nuts you eat. You can eat as much as you want. Now, why College of Lifestyle Medicine came out and said whole food plant-based diet, where is it coming from? And maybe some in the audience already heard about blue zones. So National Geographic journalists traveled around the world and look where the people live the longest. And there are 5 places in the world, as you can see: Japan, Greece, Italy, Costa Rica, and small area in Loma Linda in California, United States, where they found that people live the longest. And when the scientists travel there and look what is common, people in Greece didn't know what Japanese are eating, but they found something in common. And that in common was what I just talked to you about: fruits, vegetables, grains, beans, seeds, and nuts. So when I talk with my patients, I like to approach all food like we would approach traffic colors: green, yellow, and red. So green, I say, you eat as much as you want. You don't need to limit yourself. And that is, again, vegetables, fruits, legumes, whole grains, nuts, and seeds. At some point, especially when I talk with my patients about the weight loss, we talk about ratio between vegetable and fruit, how many fruits and vegetables I suggest to eat them every day. But initially, I say you eat as much as you want. Why those green light color foods are good? They're good because they're rich in, first of all, fiber. And fiber gives the feeling of the satiety. More fiber you eat, full you feel. Antioxidants, these are fancy words you don't really need to remember, but antioxidants helps to reduce that chronic inflammation and helps people to feel more energetic, not to feel sleepy and tired throughout the day. These products are rich in water. And I don't know if any of you, but I very frequently hear my patients saying, but I don't like drinking water. And I say, you don't drink water, you eat water. You can eat water because, again, these green light color foods, they're great. They will have good resource of water. And fancy words about omega-3 acids and monosaturated fats, these are good fats. These are fats that helps us to prevent chronic inflammation, blood vessels of the heart and brain, and protects us from heart attacks and strokes. As I mentioned, that dietary fiber is your friend. That's what I usually share with my patients. Why it is very important to have a big amount of, especially vegetables in the diet, because we know we feel full when our stomach is stretched. And there is such a thing, such a concept of calorie-dense food. So for example, in 1 pound of butter, it is about 3,200 kilocalories. So if somebody eats 1 pound of butter, here's almost 1 pound of weight gain, because in 1 pound of fat, there is 3,500 calories. But if somebody eats 1 pound of green vegetables, it is 100 calories. And you can imagine how much the 1 pound of vegetables will stretch the stomach and how much satiety that person would feel. I like to share that slide with people so they understand, because majority of patients, they come and they say, I don't feel like I eat a lot. Something is wrong with me. I really don't eat a lot. And when I discuss further, then I realize that people really don't eat a lot, but they eat very high dense calorie food. So that is very brief summary of what we should eat and we should never limit. Now, yellow color food. So yellow means slow down. And you're okay to have some of those things in the diet, but just some, not as much as we talked about other green color food. And this would be processed whole grain. So whole grain bread, crackers, processed fruit and vegetables, oils, different yogurts, peanut butter, ice cream, fish, white meats, and all of that. So again, very small amount. It's okay to have those things, but just being careful how much you take. And I like just reading all the books. I usually say my patients that this is a brief summary of how many things you can have a day. So 4 ounces of lean meat, chicken or turkey a day, about 8 ounces of fish a week. And the best fish rich in those unsaturated fat is trout or salmon, and better wild caught. Also 4 to 6 eggs a week. The reason why I put 4 to 6 because eggs topic is changing topic every week. So if I today say 6 eggs a week, maybe next week will be something differently, but about 4 to 6 eggs a week. And cheese, I put a quarter of cup of cheese because I think cheese is one of the biggest enemies, because cheese is good, cheese is tasty, but it's very rich in calories and falls into category of high calorie rich food. And also cheese is rich in saturated fat. So and cheese is everywhere. Cheese is in the sandwiches, in pizza. People like to snack on cheese and think that this is healthy snack. So I always, when I talk with my patients, I always say, be careful about the cheese. And I'm very careful about the cheese myself. Now, red color traffic is something to avoid, and something to avoid would be those type things like saturated fat, trans fat, cholesterol, sodium, and advanced glycation and products. I'll talk about those in 1 second. So red light foods are high in calories, but very low in nutrition. Unfortunately, these products causes chronic inflammation and causes the feeling of chronic fatigue and sleepy, and leads into diabetes, hypertension, coronary artery disease, and hyperlipidemia, and would be ideal completely to avoid those. And these products are refined grains. So when I talk to my patients, and when I look in food myself, I also share the color white. I say, try to avoid white in your diet. White would be anything made from flour or sugar. I always say that onion and garlic is okay, but otherwise, no. Also refined sugars, and I encourage looking into the food labels, because sugars could be hidden in many different ways. From sugar cane, sugar beets, corn syrup, and everything else. Also regular oils, olive oil is healthy, but very rich in calories. So oil has the highest density calories compared to all other foods. Fried food. So and this is springtime coming, we'll also start barbecuing and grilling soon. But unfortunately, frying food in high temperatures causes those AGEs, those advanced glycation end products go up. And these products causes chronic inflammation and sometimes could even lead into the cancers. Again, fried food is not perfect food. As I mentioned, cheese small amount, and the biggie one is the processed meat. Cold cuts, and people sometimes think that cold cuts are good. They make sandwiches, but again, there are excessive studies showing that cold cuts are associated with increased mortality. Also, sausages, hot dogs, burgers, bacons, basically processed meat is not good for us. Some of you might have heard that red meat is also considered not safe, and World Health Organization came out and said that red meat is carcinogen. However, most recent studies show that unprocessed red meat in small amounts is not as bad, but what is bad is the processed food. Again, I usually ask my patients when I talk, I say, try to back off, especially for children. Our pediatric population, the hot dogs are it's very common because again, these are causing chronic inflammation and are associated with high risk of colon cancer. So why a whole food plant-based diet is good for us? We just talked very briefly about fiber, nutrients, calories, and everything like that. But there is an evidence supporting this. And you can see that meta-analysis shows 25% improved, lowered ischemic heart disease rate, 30% decrease rate of diabetes, cholesterol improvement, weight loss, and all-cause mortality. So again, people choosing high fibrous, those green light color foods, they really die less. So that is a very quick and brief talk about what to eat and what not to eat. Another aspect what lifestyle medicine focuses at is the physical activity and exercise. And you probably know that there are a few components of the exercise, and one being aerobic exercise. Another one is resistance training or muscle training, and balance flexibility training. What I found that sometimes people who come to me and they say, oh, but I am active. I park my car in the different corner of the parking lot. I don't use an elevator. I use the stairs and etc. And I always say, wow, that's amazing that you do that. But unfortunately, it is not enough. Exercise, it is dedicated time. And when I talk about the exercise benefit, especially I'm talking about aerobic exercise, I usually say that whatever you do, you choose whatever you like, biking, walking, jogging, but you have to do at the pace when you can talk, but you should not be able to sing. If you do that, it would be considered as moderate activity. That's very easy way for me to say to my patients, try to do that. And if they exercise at the pace when they cannot talk and they cannot sing, that is considered as vigorous exercise. So this slide just shows what are the recommendations of the exercise for different age groups. And I think that majority in the room here is falling into that category between 18 to 64. And the recommendation is to exercise aerobic activity 150 minutes a week. And it doesn't matter if you do it in one day or you do it in 7 days, as long as it is 150 minutes a week, that's totally okay. And like I say, doesn't matter what you do, as long as you do it at the pace when you cannot talk and you cannot sing, but you can talk. If you exercise a lot, that you cannot talk and sing when you're exercising, that is considered a vigorous activity, and 75 minutes a week is enough. And the same thing, you can do 75 minutes of very vigorous exercise in one day or in 7 days, as long as it is 75 minutes a week. And there is a study behind that. In addition, the recommendation is to add resistance training exercises twice a week at the exercising all major muscle groups. After age of 65, the same recommendations stay, but the balance training in order to help people to reduce the falls and flexibility training occurs. Of course, I always encourage even patients above age of 65 to do flexibility training and balance training exercises, but that's very important for 65 and above because that population is associated, it has more risk of falls. And since we have the learners in the room, I pulled one study from Ireland, which shows that exercise really helps with memory. So what they did in Ireland, they asked half of the participants just to sit, and half of the participants bike until they were exhausted. And after that, they measured a neurotropic factor, brain-derived neurotropic factor, and basically just simply showed photos with faces and names. And what they found that that group which exercised they did much better and had much higher levels of brain-derived neurotropic factor. So on those days when you say, I'm just reading and I cannot remember, please consider implementing the study, which was done in the study information, which was done in Ireland, and maybe just add simple things like exercise. Physical activity benefits all-cause mortality. So again, if we're looking at the also longevity studies, physical activity is very, very important. It's probably one of the most important aspects of the lifestyle medicine. But the same thing, cardiovascular disease prevention, blood pressure controlling effect, diabetes, fall prevention, but look also cancer prevention. And especially for my patients who have a history of breast cancer, or have a family history of breast cancer, or have personal history of colon polyps, precancerous stages, I talk to them. I say, your life is in your hands. You can do it. Just add physical activity. Also, attention deficit disorder symptoms, mood, like anxiety and depression. There's a study I share with my patients showing that vigorous exercise 3 times a week for 25 minutes works the same as sertraline or Zoloft. That's the depression medication. So again, we know there is proven evidence to see that physical activity is important. What I also learned from my patients that they say, I exercise, but I cannot lose weight. Many people, when they come to us physicians, they say, I really try to eat healthy, but then we realize that they eat larger amounts of dense calorie food, and they exercise, but it's not enough what they do. And to lose weight through the physical activities is very difficult. As you see, in order to lose weight, person needs to exercise 1 hour, at least 5 days a week, to lose 5% of the body weight. It is difficult to achieve. Our lives are busy, and to exercise for 1 hour every day, it is challenging. That's why for the weight loss, I like to talk with my patient about the diet being a core treatment for the weight loss. But for the longevity, for mortality, for other disease controlling effect, exercise is very, very important. The next pillar of the lifestyle is sleep. And poor sleep is associated the same thing with those chronic conditions we've talked about, including impaired immunity, mental distress, depression, anxiety, ADHD. And sometimes we don't even realize how important it is to get sleep. There are studies showing that only after 3 or 4 hours without sleep, person could hallucinate, right? So that is very important. This slide was taken from the National Sleep Foundation, just saying that, and you can look at the age group, but for ages 18 to 25 and 64, 7 to 9 hours of sleep, it is recommended. But what is important is not only how many hours we sleep, but what's important is the schedule. It's very important to go to the bed at the same time and get up in the morning at the same time in order to get good quality of sleep. The next pillar talks about positivity. So especially in this world of the information and different news and everything, it is very important to not to forget about positive things. And I usually talk with my patients and I share with them and I say that, unfortunately, positivity whispers, but negativity screams at us. And if we hear some negative comment or something like that, just one negative thing, it takes about 3 positive to undo that one negative. This is how we are wired evolutionary, but it's important to remember that. But the nice part is that we can train our brain towards positivity. And there are many different activities, if you look in the literature, how to train your brain to look positive in life, to push negative things away. And from what I've learned, I found that gratitude is one of the most powerful tools towards the positivity. And simple things like being thankful, thinking by the end of the day, and especially writing down 3 positive things, what happened throughout the day, what impact I had, could be very powerful of helping us to look into this world and to the challenges we face with the positivity. And another aspect of the lifestyle medicine is social connections. So I wanted briefly to share with you Harvard study of adult development. Maybe some of you already heard about that, but this one is one of the longest longevity studies done in the world. It started in 1938 in Harvard and included boys from Harvard University, but also boys from suburbs in Boston. And for 85 years, those participants, some of them died, some of them are still alive. They were questioned. Their cholesterol were measured. Their blood pressure was measured. Many different tests were done. And by the end of the study, scientists came up with most important thing would help people to live long and feel happy. And what it was social connections, being connected with others. So either it's your friend, or maybe that's your spouse, or maybe you're doing community services. But the social connections are very, very important. And again, Harvard study shows that social connection was the most important thing, helping people to feel happy and fulfilled. And when we are happy, our inflammation, our stress hormones go down in the body, and that is associated with longevity as well. And the last is substance use. So the substance use could be another 20 hours of talk, but I will try just to quickly just share with you what we see now in this country. So again, slide is from 2021, and you can see that alcohol, nicotine, vaping, tobacco products, marijuana. So basically alcohol, tobacco, and marijuana are most common substance abuse in this country. Unfortunately, this slide is a sad slide from 2023 showing that unfortunately the overdose deaths are rising, and you can see that male deaths are going up further and further. This is very sad to see that. This slide I also wanted to share with you and show that up to 2019, males were using substance more than females. But since 2019, we see that females are using more substance as compared to males. Males overdose more statistically, but the females, and we're talking about, as we discussed, alcohol, marijuana, tobacco, unfortunately surpasses male now. You don't need to be a doctor to understand that, again, substance abuse, unfortunately, is not associated with anything positive. So I just briefly talked about those lifestyle medicine pillars. And I already shared with some of you how I implement lifestyle medicine aspects to my daily clinic life. So I do one-on-one, what we call comprehensive lifestyle medicine visits. So patients come to my clinic and I spend 1 hour just obtaining history, but also sharing about what to eat, what not to eat, how much to exercise, how to sleep, how much to sleep, and different aspects. I also do lifestyle medicine group visits when my patients come to the group setting. These are 1 hour visits, 6 weeks, that lasts for 6 weeks. So we have a group discussions about lifestyle. I also implement lifestyle medicine aspect during my regular preventative visits when I do well health exams for children and for the adults, and do what we call sick visits. So sometimes people say, I see that they have a high cholesterol, and some of my patients say, but I don't want to take medication. I say, great, I love it. Don't take medication. Come here, we're gonna sit and talk about what to eat, what not to eat, how much to exercise to bring your numbers down. And I'm also very excited that MSU MyMichigan Alma residency program is one of 2 programs in Michigan accredited through lifestyle medicine. And we teach, there is a robust curriculum through College of Lifestyle Medicine. And you can see here, like total 120 hours are dedicated in 3 years of residency training towards lifestyle medicine. And by the end of the residency training, the residents could sit for a family medicine boards, but also lifestyle medicine boards. Because I really feel that future, especially as primary care providers, future with our patient really depends on the lifestyle, because it is concerning to see such a sick population, and we can do more educating patients, because as I shared, 80% of people really want to do better, but they don't know where to start, and we have room for the improvement. I also wanted briefly to share with you, if in case you want to look at something online and just learn a little bit more. So there are a few apps like Daily Dozen app, MyFitnessPal app, website nutritionalfacts.org if you want to do a little bit more research and look into that. I also love and personally use every day Yuka app. I don't know if any of you heard this YUKA app. Initially, it was built in France, I believe in 2017, but that's a very nice app when you scan the barcode, and the app tells you if the product is safe to use, is it good, does it have how much fat and sugar and additives it had. So again, I would strongly encourage you to look into that. And this is just a brief summary, just showing that those 6 interventions I was talking to you about could prevent 80% of heart disease and diabetes and 40% of cancers. But again, we are obligated to do our job as physicians, as future physicians, and we can change our population health, and also implement that to ourselves, because it really, I feel that whenever I became board certified in lifestyle medicine, I started focusing on this, because I felt like hypocrite asking people to exercise and not doing it myself. And I think that is very important to be the example for your patients. I would like to finish my talk with a phrase which I took from the movie Gladiator. And maybe you remember, they said, what you do in life echoes in eternity. So I rephrase that, and I want to say that what you do in life echoes in your body. And again, robust evidence tells us that what we do really matters and could change the outcome. So thank you very much. And if any of you have any questions, please. Thank you.
Start with at least one online, and if you can repeat for those virtual as well, that'd be great. How can individuals decrease their risk of developing Alzheimer's disease, and how to treat Alzheimer's?
Very good question. So question is about how to prevent Alzheimer's disease and what we can do to treat Alzheimer's through the lifestyle interventions. So we think that dementia people develop because of chronic inflammation. And the chronic inflammation is caused by those red color foods I was just talking about. Foods very rich in sugar, saturated fat, glycation products. So reducing inflammation might help to reduce inflammation in the brain vessels, and that would reduce the risk of the Alzheimer's disease. Now, also another aspect, physical activity. So physical activity improves the blood flow in the brain, and being active and being connected. And I always say, you use it or lose it. So when my patients come to me and say, I think I have some memory problems, I say, make sure you sleep well, because that's when the brain will recover. Exercise, eat healthy, be connected with others, because the study, Harvard study of adult development also showed that those people who had a very strong connections, they had less dementia too. So implementing all of those lifestyle interventions really helps. And I also talk with my patients, and I think what is also important to recognize is that it's not one thing, but the summary of things works. That's why we talk about diet, exercise, positivity, being connected with others, because this is everything, not one single thing. Any other question? Very good question is about if we have dietitians in office. No, we don't have dietitians in office. We have dietitians in what we call diabetes centers. So when people are diagnosed with diabetes, that's when they see dietitians, but we don't have those in office. There are programs, there are diabetes prevention programs. So again, you can simply go online, and these programs are, some of this you can get, some of information you can get for free. So again, diabetes prevention program is one of them. And people can get information from that too. But what I've learned when people come to me as their primary care provider, and when I talk to them myself about cholesterol, about diabetes, I think they listen a little bit differently because they trust. If the patient come to me for 10, 15 years and they trust that I can treat their cholesterol with lifestyle interventions, I feel that's what is very important for us primary care providers or any specialty, to be connected with people and share what we know about lifestyle medicine. That's a very good question. And I wish I could do more lifestyle medicine than I do. The question was, what are the challenges implementing lifestyle medicine in regular clinic life? And the answer is time. Time is limited because we have many patients and people come for different reasons. But I make it a priority. And sometimes I say that maybe I'm gonna work a little bit extra hour just to change the outcome. So I think time is the biggest challenge. I think because initially I also felt that people were kind of iffy a little bit about the lifestyle medicine, but because lifestyle medicine is gaining popularity, more and more patients are more open to lifestyle interventions. So I feel that challenge is kind of going away. Yes. Very good question. The question is about, do I recommend my patient buy organic? The answer is no. I don't recommend buying organic because of the cost-effective reasons. But if my patient could afford organic, I would encourage that. There is a website, I might be mistaken, but I think egw.com, and you can go on that website and it talks about the pesticides. So when they look at the fruits and vegetables, about 97% of organic did not have a pesticides in there. But berries, peppers, unfortunately, are contaminated with the pesticides. But what I also found, this does not come from the College of Lifestyle Medicine, I found that in different literature. Simple recipe, like taking 1 tablespoon of baking soda, mixing that with 2 cups of cold water, and placing vegetables and fruits in that water really kills the pesticides because it changes the acidity. I'm not a chemist. You might ask questions to the chemist, but again, there are some studies showing there is evidence saying that pesticides could be killed by simple things. So again, 1 tablespoon of baking soda, 2 cups of cold water, and just keep your vegetables and fruits for 15-20 minutes. So what I do personally, when I come home with my vegetables from the store, I just put them into that baking soda water for 15-20 minutes, rinse, and I think then I eat organic.
So we have a question from one of our faculty members, Janice Simmons, who's actually alum of Alma College and the recent scholarly work is focused around mitigation of anti-fat bias and focusing on health. Do you see this mindset change among your colleagues?
The question is about change of mindset between the weight loss versus active lifestyle. So I do see that, but I think I do see this because we in the medical field, we talk more and more about not following diet, but implementing lifestyle. You also, probably everybody in this room heard about work-life balance, which I try to avoid this because I think the balance is also not perfect word. I feel that integration is better word. So do I see the shift? Yes, but the change is not from here to here. I feel that the change is just very, very slow. But like I say, since 2020, when I became board certified, where we were at that time and where we're now, look at this room. I don't think that I would have this room full of people in 2020. So lifestyle medicine is changing, and aspect is changing, and people are understanding more and more. Absolutely. So that's what I always say, you eat as much. The question was, how do I promote my young population, young females, about healthy eating and maybe not causing, I think the question also is about eating disorders, how not to cause the eating problems in the future. And that's what I talk about, those green light color foods. And I say you can eat as much as you want, you don't limit. This was gonna help you to feel good. It's gonna help you to look young forever because of decreased chronic anti-inflammatory effects. So I never discourage people from not eating something. I always encourage them to powering up good foods in the diet instead of eliminating. And what interesting thing would happen, the people would say, oh my gosh, I did not realize how bad I felt when I was eating my donuts or something like that, because they feel the difference. They know the difference when they follow a healthy diet.
Rice and pasta, any good or better versions to eat for health?
Rice and pasta, is it good to eat? So rice falls into that of the yellow color food category, but brown rice or wild rice is much better than white rice, because remember we talked about that bran. When bran is removed, all nutrients and fiber is removed, so white is not perfect. Pasta, bread, whole grain. If you look for pasta or if you buy bread, look for whole grain bread, but also not very large amounts because of the high calorie dense food. But white color I would avoid in the diet, except garlic and onion.
How is lifestyle med different from functional?
Lifestyle medicine is focusing on those 6 pillars I was just talking about, and functional medicine, I don't know. I would not be able to answer that question. Yes.
We had the opportunity to ask this question before the last. Would love to speak a moment to patients come to you concerned about being able to afford eating.
The question is, what do I recommend for those patients who are concerned about finances and they say, I cannot afford healthy food? So first of all, lifestylemedicine.org, they provide eating on the budget information, including the recipes. So this is where I sometimes direct my patients to. Second, the healthy food is not as expensive as people think. There are books, cookbooks called How Not to Diet Cookbook and How Not to Die Cookbook. These are very simple recipes. Also farmers market. So personally myself, I go to farmers market and I buy large amount of beans and then apples, and I just put beans in the freezer, apples in the cold place in the house, and I eat those apples till probably first week of January. And so I feel that sometimes people think that healthy foods cost more than they actually do. What I feel is a little bit challenging to make healthy food at home is time, because it takes to prepare food. But when I talk with my patients, I always say invest into the food processor, because food processor is just will save time chopping the vegetables and everything else. And also planning. I think the next important aspect of eating healthy is to plan food for the week and also plan shopping. So when I go shopping, I look for things on sale and I buy frozen berries, frozen vegetables. If they're on sale, I put them in the freezer and use later. Frozen food is good. Canned food is not good, except beans, artichoke, and corn. But frozen food is perfect. Any other questions? Okay, thank you so much.
So thank you, Dr. Klugiene. Thank you, Dr. Turk and Alma College for hosting us once again this year, and MyMichigan Health and Michigan State University College of Human Medicine for co-sponsoring, and all the medical students and pre-med students that were involved tonight. Have a great night and safe travels. Thanks.
Thank you all.